Quite a few over the next couple of days. 4th of July, the grandkids coming. They leaving.
Magnolia, Mississippi is a small city, according to Mississippi standards, a city of approximately 2,700 residents. Our population has a high poverty index. Most, maybe 50% or more of the citizen lives 150% above the national poverty index.
I am Edgar Lewis, and I am the senior pastor of New Zion Baptist Church. Magnolia is a laid-back town, a very friendly town. Used to be booming. We was getting people from Tylertown, Liberty, Brookhaven, and they all came to Magnolia because we had a theater, we had grocery stores, drugstores, and all those things here, and a hospital.
Beecham Memorial Hospital was one of the largest employers in the city. When I came in as mayor, Beecham employed approximately 100 employees. Due to the significant cuts in revenue, they had to lay off 50 employees. When you lose 50 employees in a city the size of Magnolia with 2,700 residents, it has a very negative impact on your economy. Those are employees that did business right here in the city of Magnolia. They took their lunch break and they spent money here in the city. When I took the helm, the hospital, which is the physical property, was partly owned by the city of Magnolia and the county. They approached the city and the county to ask for funds to make it through a few months of payroll and paying bills. Well, when you budget to run a city, you budget for just that, to run a city. And unfortunately, we did not have funds available.
As I can remember, I know just before 2012 when they started talking about the photovac care coming, and they were not going to accept it, and they're going to continue to operate, and they thought they were going to be able to and still, you know, do business as usual.
I'm sure the lack of Medicaid expansion being an option in Mississippi contributed to that. As a matter of fact, my discussions with hospital administrators confirmed that that was one of the problems.
And that's when I really became perturbed, because what it was doing to our people, you know, our community here in Magnolia, and like, cause our people were loyal to Beecham because that's all they ever knew. And Beecham is just like one of the nursing homes, you know, I would think. That's all it is. And that's what it's going to be until somebody, the government or somebody, put some money in there to make it better, you know.
You're going to see hospitals all across the state began to have to reduce services, lay off employees, and many instances hospitals will have to close. So regardless of whether you own health care, you qualify for Medicaid or you benefit from Medicaid, the lack of expanded Medicaid will hit you right in your backyard. It will come knocking on your door.
There are so many people confused in this changing healthcare environment about who's accountable. We had to constantly do our best to educate people as to why the hospital was experiencing financial hardship. And I even had some folks who wanted to blame Obamacare. And I had to quickly remind them that in Mississippi, Obamacare does not exist because Obamacare encompasses you having Medicare expansion.
Being in the state right now, do you think it effectively serves the needs of this community?
No. I don't think it. I think it's just business as usual.
Our hospital did a couple of things. One, it went to a different form called critical access. And that is a type of hospital arrangement that allows for hospitals to continue to survive. The problem with that, though, is that we did lose some things, and one of the things we lost was our ICU. So we lost some of our muscle, some of the ability for us to take care of the types of patients that we were used to taking care of as a result of having to go to critical access.
When I read that article where the governor had talked about community health centers being the answer for access to care, in one small component, I absolutely agree with him. But healthcare centers, community healthcare centers, we're not the only answer. We serve the primary healthcare needs. We don't perform home health. We don't have hospice. We don't do inpatient care. We don't do long-term behavioral health by and large. You may see some pockets of that throughout the state, but they're not enough to meet the need, nor are they on a large scale sustainable. We continue to see a large number of folks who come in for episodic care because they yet do not have access to insurance coverage, which would provide them that access that they could afford.
God forbid I get sick, I wouldn't be able to go to work and I wouldn't be able to go to the doctor without having an enormous medical bill from the hospital. Whenever I have a doctor's appointment to come up, just put back at least enough to get in the door to see the doctor. And if I have to hold on to prescriptions, for weeks at a time when I need them right then until I can get money to pay for them. And that's what I have to do.
If they had the health insurance that they need, then they would not have to worry about, paying the rent versus coming in and getting their high blood pressure checked and getting their high blood pressure prescription to keep that controlled so they can continue to have, a job and a meaningful career. What you're talking about is an opportunity to dramatically change, people's access to care.
It is the terminal consequences of a disease that is so expensive and it is swamping the state of Mississippi. Frankly, I've been very disappointed in my world, the world that I dwell in, and that the healthcare community has not been more outspoken on this. And the fact of the matter is, I think that they were trying to be respectful of our State House leadership, which I think has been very wrong-headed about this. And I think history will describe this as a major misstep